This is chapter 2. It's the emergency kit, and every office has an emergency kit. We'll always have the emergency kit out on the counter in the clinic, right below all the open cubbies. Everyone needs to know where the emergency kit is, wherever they're working or going to school. So the best kind of emergency kit is one that is custom designed. It's very simple. It doesn't cost a lot of money, very economical, readily available for use. It's mobile. You can take it back and forth quickly if you have an emergency. You need to have easily accessible oxygen. Some offices have it built into the operatory rooms, and some have a portable unit like we do here at school. So only include in these what everyone knows how to use. You can buy some of them ready-made. A lot of times they have things that you aren't going to need. So if you a simple one, then you need to have only in there what everyone knows how to use. Because if you don't know how to use it, you're not going to use it. Consider the location of the kit in an urban setting in the city. The quick EMS response that comes requires you to not have as many ingredients and as many drugs in your emergency kit because they'll be there so fast. If you're out in a rural setting, you might want something that's a little larger that encompasses a lot more, since it will take maybe someone a little longer, EMS to get to you. Oxygen is used for all emergencies except hyperventilation, and we'll have a chapter on hyperventilation as to why that is, but basically just a shortcut is that when you hyperventilate and you're breathing so fast, there's a lack of carbon dioxide in your system. When you breathe oxygen in and then you breathe used oxygen back out and carbon dioxide, you're breathing out carbon dioxide. And so that takes a minute to be able, in a normal breath, to be able to occur. But when you're breathing super, super fast, there's only time enough to get oxygen in. And there's not really time enough for there to be able to get the exhale all the carbon dioxide. So if that's what you're doing and having just an enormous amount of oxygen with no carbon dioxide exchange, then you would not want to give that person more oxygen. Okay, so that's why oxygen you can usually give to everybody except for hyperventilation. This is a type of oxygen tank we have in our clinic. It's a portable size E oxygen cylinder or tank. A tank like this gives 30 minutes of oxygen, and you would probably need to know that it's a size E and is 30 minutes. Essential drugs. Epinephrine, another word for that is adrenaline. Also, it's a hormone and a neurotransmitter. Epinephrine or adrenaline is clear, it's colorless, and it's used for anaphylaxis in the most severe form. When your anaphylaxis, your throat is closing shut and you're close to asphyxiating. So it reduces hypotension. Hypo is less than, tension is blood pressure. So it reduces the low blood pressure, the bronchospasm. If your laryngeal edema is when your throat closes shut and swells and closes shut, prevents additional release of a histamine and other chemical mediators. So it does quite a lot for anaphylaxis. Here's an EpiPen for an adult and for a child. The epinephrine for anaphylaxis. The epinephrine is very quick to take control, rapid onset, but it doesn't last very long. It's a really short duration. An adult dosage is 0.3 milligrams of a 1 in 1,000 ratio. We will be discussing what this is in later courses, but for right now, you would do well to memorize that. Epinephrine on an adult dose is 0.3 milligrams of a 1 in 100, I mean, a 1 in 1,000 solution. So a pediatric dose is half of that, which would be 0.3 milligrams of a 1 in 2,000 solution. And it's followed, you always follow epinephrine or an EpiPen with a histamine blocker. So it's for a severe asthma attack also when they're going into anaphylaxis maybe. You should not use an EpiPen if they have an ischemic heart disease or really severe hypertension. Epi has an effect on the heart that it can cause the heart to beat a little faster and race. So if someone has really, really high highs, like we're talking 160, 180, 100, 200, you would not use this because it would cause the heart to even beat faster, and it's going fast enough. So the doses can be repeated on epinephrine until the anaphylaxis symptoms subside. Since the actual effects don't last very long in your system, you can repeat them. Essential drugs, nitroglycerin. You want to have a kit that has nitro in it. It reduces high blood pressure. So if you have, if the chest is hurting or has pain or has a heart attack or congestive heart failure, the nitroglycerin is going to dilate your coronary blood vessels, and that's what you need. It has a very rapid onset within minutes, and it comes in a tablet or spray form. The tablets become impotent if exposed to light or air. So you need to use, they usually come in a dark bottle or something that is very dark in nature, and if you take the cap off, you want to replace it like really quick. So shelf life is reduced to 12 weeks only with air, and then they would have to buy some more to have an effective dose. The spray shelf life usually lasts for 2 years, and one little spray equals 1 tablet. The problem with the spray sometimes is that the spray is dispersing in all directions. So it may not, all of the dosage may not get where you want it. Where a tablet, you're going to ingest, and every bit of that is going to be in your system. So if you have nothing else, though, use a spray. So here would be an example of a lingual or nitroglycerin spray, and you can see here it says do not shake and hold it upright. So you need to be able to know exactly what to do with these. You administer the tablet sublingually, administer at 5-minute intervals so they can have up to 3 doses. It says you can administer this until the anaphylaxis subsides, but the normal dose, and it usually works within every 5 minutes, you give another tablet or spray underneath the tongue, and you would give up to 3 doses. So it'd be like 15 minutes, you're giving 3 different doses, and usually by then EMS is there, or they have come out of it. So you should not administer if their systolic blood pressure is less than 90, okay, because it is going to, it may affect that. Nitroglycerin is going to dilate the coronary arteries, like it said, which means anytime you dilate the blood vessels, the blood pressure can go a little lower. So if someone already has a systolic of 90, millimeters per mercury, which is what capital Hg stands for, millimeters per mercury. And if they already have 90, you don't want to give them something that is going to decrease their blood pressure even more into a dangerous point. So we would not want to give that. You would need to know that. So some other is diphenhydramine or chlorpheniramine. Diphenhydramine is actually Benadryl when you see over the counter, and chlorpheniramine is chlortrimeton. So what these do, they are antihistamines. They're oral histamine blockers, so they're called antihistamines. It's for a moderate allergic reaction. So they're not going into anaphylaxis, but they have a moderate allergic reaction, and they may find it hard to breathe. So you would give this. Now, as I said before, dental hygienists are not going to administer drugs, but you can have these out of the emergency kit and ready in case your dentist would want to. So here's a picture of chlortrimeton that we all buy, antihistamine, and this is diphenhydramine or chlorpheniramine, also come in a injectable, where you get this syringe, and then you also have this liquid. Pediatric doses is 1 milligram per kilogram of body weight and should never exceed an adult dose. They should have a pediatric dose on the bottle. Chlorpheniramine does not cause as much drowsiness as Benadryl does. We all know that Benadryl can cause some real drowsiness. And if the person is going to be driving home, that's a concern. Albuterol. Albuterol is used for asthma attacks or bronchospasms. It's an inhaler. It dilates the bronchioles, and it has very little effect on the heart. So it has a really quick onset, and it takes like 30 to 60 minutes to come to its peak. It's a long duration of action. They consider it working from 4 to 6 hours, and on like an adult, 2 sprays. And a pediatric dose would be 1 spray, and you can repeat the dose if necessary. This is what a spacing device for children looks like. They put this yellow inhaler in the end of a spacing device. There's a hole just big enough for the inhaler part to go through, and then the child breathes through this takes the blue cap off and breathes through that part very evenly, because children have a hard time breathing in at the exact amount of or taking air in their mouth at the exact time that they're pushing down the spray. Usually they spray it and then open their mouth, or vice versa. So this is a good way to put the spray into the air, and then they just keep breathing the air so that you make sure that they're getting the full dosage. Aspirin. Aspirin reduces overall mortality from heart attack or an MI. So it prevents the progression of cardiac ischemia to cardiac injury or even cardiac tissue death. So it doesn't make it stop anything that was before, but it would prevent the progression of these. The recommended dose is 162 to 325. What that amounts to is 2 to 4 baby aspirin. The baby aspirin is 0.81 milligrams each, and so, or 81, some of them say they just drop the point and say it's 81 milligrams each. Now, if you take 81 times 2, that's 162. If you take 81 times 4, it's 324. But all the books have the dosage from 162 to 325. So that's 1 more milligram. So it just is how it is. It doesn't make sense mathematically, but in terms of a dosage for medicine, this is the way it is. So this is the way you have to memorize it. You want to check their medical history in case they have an allergy to aspirin before you would want to give somebody aspirin to if they're having a heart attack. This is oral carbohydrates. Added this to the study guide. These are different forms. We have a glucose 15 here. You would pop this open and they would consume the entire tube. So they need to have that much. You might give them sugar if they have hypoglycemia, that is. And this is only if they're conscious, or you give them a tablet. Okay, this is not actually a drug, but it is very necessary if someone is hypoglycemic. So the pastes or tablets do not require refrigeration, so that's nice. Sugar cubes, juice, icing, etc. Some of that, of course, is going to require refrigeration. So this is called glucagon. This is the answer to a hypoglycemic patient who is unconscious. Obviously, if they're unconscious, they can't chew up a tablet or keep it underneath their tongue or consume sugar or paste. So they have something called glucagon, and that is for the unconscious patient. It is also an injection. It's an administered IM, which means intramuscular. The adult dose is 1 milligram, and pediatric dose is half of that. Other drugs that you can have in there: corticosteroid, prevention of recurrence of anaphylaxis. Something happens with if someone is anaphylactic, they can have a recurrence of it at some time later, like after they're at home. They may have a recurrence of the anaphylactic episode, hours later or a little longer or even less. So if you're going to give someone something for the anaphylaxis, then you follow it with some type of corticosteroid. So something that is always synonymous with corticosteroids is an adrenal crisis. It reduces the histamine release, and there's a slower onset greater than 1 hour. So it's not great for an immediate emergency relief. Anything that they give, like that hydrocortisone drug of choice in the dental office, it has a really slow onset. So we tend not to give that if there's an immediate emergency, but we might give it for prevention of recurrence at a later time. The most popular hydrocortisone that they use right now is injectable. It's called Solucortef. I remember this word on my boards way back in the day, Solucortef. But this would be for an injectable hydrocortisone. Injectable benzodiazepines. You need to keep these. Benzodiazepines have a tranquilizer effect. They give them to people with epilepsy or for skeletal muscle relaxation. It's an anticonvulsant. And so it prolonged seizures or hyperventilation. They can give this because it's going to relax everything. It has a tranquilizing effect. Lorazepam, there are many different types of, there are names for this type of a tranquilizer effect of benzodiazepine, as you'll be learning. Even below, there's Ativan, Valium, Xanax, Klonopin, Versed, and they're all brand names for benzodiazepine. But lorazepam right now anyway is usually the drug of choice for this. So this is an injectable lorazepam. I'm going to keep repeating this throughout the course, in that hygienists don't give these, but you need to know about them. Maybe you can have lorazepam out and ready for a doctor. I was in an office that was mixed with dental personnel and MDs, so we could have easily gone down and asked for a doctor to come up, and you'd want to have something like this available. If EMS comes, they usually have this with them. Additional items, you want a blood pressure cuff and a stethoscope, and it's nice to have a pediatric, adult, and large adult blood pressure cuff. If you give take someone's blood pressure with a small cuff and they have a big arm, it's just squeezing it to get that cuff tight. It's not going to give an accurate read. Conversely, you give somebody that has a really super skinny, bony arm, and you put an adult cuff, or like a child, you put an adult cuff on them, it may not always read really accurate. So it's nice to have different sizes in your office, and as we have here in the clinic. These are additional items too. The pocket mask with a one-way valve. You'll be familiar with this, talking about this during your CPR. This is just kind of in there that might be nice to have. It's called a perio retriever. It's a long handle, and it has these tips on either end are kind of bent, so we can finagle them around the gingiva, and they are magnets, so that if the tip of your instrument breaks off, you can put this around and find the tips so that they don't swallow it, which could cause infection. So we need, if a tip breaks off, and rarely they do, but they can if you're not taking care of your instruments well. So you could use something like this to remove the tip. I don't believe we have one of these in our clinic because we just, knock on wood, take care of our instruments and don't break the tips off. But there are other ways to remove a broken tip, which we'll learn in this course later on. But just want you to know that this does exist. Additional items, you could have an ice pack for bruising or swelling from anesthetics. And you would need to have, they have those that you can have up in the, just in a storage closet, and then you kind of crush it and it becomes an ice pack, which is great. We have those definitely in our clinic. Extra syringes, thermometers with sleeves. And of course, this is what the books are going to say. This is what a board question may say. So that's why I didn't take it out. Because as we all know, with this COVID thing going around, people are not using thermometers with sleeves. They're using different types of temperature gauges. So an AED is another thing that is really nice to have. We have one on the first floor, and actually now even on the 4th floor of our building. And it's nice to have assorted bandages and gauze. We have some different emergency kits, and we see them so often that it's easy to just look right past them and not realize what they are. We have an emergency kit, a blue portable emergency kit that always sits on the countertop, like I said before. And it's portable and has a lot more drugs. But we have first aid kits that are on the wall. One's inside the sterilizing room opposite of the ultrasonic, and it has just Band-Aids and triple ointment cream, gauze, different things for just first aid. There's also a first aid wall box in the 510, room 510. It is usually the dental materials lab, and lab we use for other things. So there's one, if you walk into that room and flip the light switch on, your hand is practically on it. So it's just right inside the door to the right. So that is takes care of the second chapter on emergency items.